see, ma'am. Can you please explain that?
Definition of excision, am I right? Actually, I already completed. I just put a message on our WhatsApp group also. Please join after 5 o'clock. I just put the message. Please join again. Because due to some network issue, I lost 30 minutes, 20 minutes. So that's why I'm continued. I extend the session up to 5:25.
Yes, ma'am. I checked at 5:20. I joined at the time. Class is over.
Okay, once I complete the entire topic, I will take the classes again for you because all of them are attend the excision classes. So I will take the classes after completion of the topic.
Okay.
So nail surgery. So nail surgery, trimming of non-dystrophic nails. So for trimming of non-dystrophic nails, any number means for single or more than one nail, you just apply the code only one time, 1171. And 11720, debridement of nail. Debridement means cleaning. Cleaning the nails for 1 to 5 nails, 11720. For 6 or more nail, 11721. So debridement of nail, 1 to 5 nail, 11720. For 6 or more nail, 11721. It's a direct coding, then avulsion. See that the image, that is the procedure of avulsion. Avulsion of nail plate, partial or complete, single. For single nail plate, 11730. Each additional nail plate, 11732. For single nail plate, 11730. Then for each additional nail plate, go for 11732. And excision. Excision means removal. Removal of nail and nail matrix. See that. Removal of nail and nail matrix. Permanently remove the nail. So here, doctors permanently remove the nail. So go for 11750. 11750 for removal of nail and nail matrix. Then 11755 for biopsy of nail. Doctor obtain the sample from the nail. Doctors obtain the sample from the nail. Go for 11755. Repair of nail bed. See that. This is a nail bed. Surgeon just to make a suture at a nail bed. Go for 760. Reconstruction of nail bed with the graft. So surgeon makes harvested tissues or muscle from another location and placed at the nail bed. Placed at the nail bed. So nail bed with the graft, 11762. And for wedge excision, go for 11765. For a wedge excision, so that is one of the technique. That is one of the technique to remove for excision. For wedge excision nail fold for ingrown toenail. So they are removing the ingrown toenail. Go for 756. So these are the direct coding. No guidelines here. Then, so 11920 for removing of tattoos. Removing of tattoos. So if the measurement of the tattoo will be 6.0 or less, go for 11920. From 6.1 to 20.0, 11921. And for each additional 20 or partograph. For each additional 20 or partograph, 11922. 11922 for each additional 20 or partograph. So these are the code section for removal of tattoos and collagen filling to remove the wrinkles. This is one of the treatment for anti-aging treatment. remove the filling of collagen material to remove the wrinkles. For subcutaneous injection of filling material 1 cc or less 11950 1 cc or less. For 1.1 to 5.0 11951 and 5.1 to 10.0 11952 and over 10.0 11954 according to the cc, according to the injection, that means quantity of that injection. We have to select the appropriate code here, filling of collagen material. And this is one of the device is placed under the skin to control for the treatment of hormonal disorder. This is one of the device for the treatment of endocrine disorder, hormonal disorder. That device is called as contraceptive capsule. Contraceptive capsule. This device is placed under the skin. Okay, so to treat the hormonal disorder. For the inserting of that device 980, removal of device 976. For inserting of the device 980, removal of device means go for 976. That's it. Okay, direct code. No guidelines here. Then tissue expander to expand the tissues other than breast, because we have a separate code for breast. We have a separate code for breast tissue expander. So other than breast, for another anatomical location, we can apply this code section. For another anatomical location, we can apply this code section. 11960 for inserting of tissue expander, 960. Replacement of tissue expander, 970. Removal of tissue expander, 971. So for inserting of the device, 60. Replacement means remove the old one and insert the new one. Replacement means remove the old one and insert the new one. For replacement of tissue expander, 970. For removal of tissue expander means go for 971. And repair. Repair means just like a suture. Stitching. Repair is nothing but suture. In that repair, we have 3 classification: simple, intermediate, and complex. Take a note. Simple, intermediate, and complex. So simple means that involve in a one layer. That involve a one layer only. Simple means one layer closure. One layer closure. As well as doctor will use only one suture material. So simple repair that involves only one layer, and doctors will use only one suture material. Okay, we already discussed in our last session for which the 3 concepts we have to report the code separately for each lesion. For which 3 concepts we have to report the code separately for each lesion.
Excision,
shaving, and destruction. Super. For the concept of excision, shaving, destruction. For these 3 concepts only, we have to report the code separately for each lesion. Am I right? Apart from that, for the rest of the concept, for the same group, we can add the value. Different group, we should not add the value. For example, scalp 2.0, neck 2.0 means we can add the value of scalp and neck. Scalp 2.0 and neck 2.0 means we can add the value because scalp and neck that comes under the same category. Scalp and neck that comes under the same category. That's why we can able to add the value of scalp and neck. What is the code for 4 centimeter?
12002.
12002. For 4 centimeter, 12002. Same like that. So we can able to add the value of face, ears, eyelids, nose, lips, mucous membrane like that. Okay, but we should not add the value of scalp and face. Why? Scalp that present in the
Two different groups.
Two different groups. Because scalp that present at the group of 12001. Face that present at the group of 12011. That's why we should not add the value. So we should report the code separately. For example, C, trunk 5 centimeter, face 4 centimeter. Check that trunk and the face that all comes under the same group or a different group?
Different group.
Different group. That's why here we are reporting the code separately for trunk and face. For trunk 5 centimeter, 1200 because trunk is present under this group. Trunk 5 centimeter, 12002. Then face 4 centimeter, 12013. But in that second example, trunk 5 centimeter, feet 4 centimeter. Check the group, guys. Is it present under the same or different?
Same group.
Same group.
Same group.
Okay. Trunk and feet, including hands and feet. So for trunk 5, feet 4. We have to add 5 plus 4, 9. For 9 square centimeter, go for 12004. So here, same group, we should add the value. Different group, we should not add the value. Did you understand?
Yes,
Did you understand that? Take these two examples. Okay. Take these two examples.
Ma'am,
Yes. Then,
trunk is 5 centimeter and feet is 20 centimeter.
so what are the locations? Sorry, I can't understand. Feet 25 centimeter. Am I right?
20.
20. Then next anatomical location is
Trunk is 5 centimeter.
trunk. So trunk and feet that comes under the same group. So trunk 5, feet 20. So 20 plus 5, 25. 25 means go for 12006. Okay, 25. So that's why go for 12006 from 20.1 to 30.0. From over 30.0, that means from 30.1 up to 30.0, go for 12006. Over 30.1, go for 12007. Clear now?
Yes, ma'am.
Yes, ma'am.
Okay. Shall I, guys, these are the key terms for that simple repair. Take that note also. So these are the key terms for simple repair. So the same concept would be follow for the entire thing except excision, saving, restriction. For the remaining concept, we have to follow the same thing. That means same group, we can add the value. Different group, we should not add the value. Now, so the same concept for the intermediate repair also, but take a key point for intermediate repair. 2-layer closure that involve 2 layers, that like epidermis and dermis, dermis and subcutaneous, like that 2 layers will involve in intermediate repair, and 2 suture material. Doctors use 2 suture material. In this, doctor just make a 1-layer closure, but with the foreign body removal we should consider as intermediate. So doctor just make a single closure, 1-layer closure, but with the foreign body removal means we should consider as intermediate repair. As well as extensive cleaning with the 1 layer is also considered as intermediate repair. So these are the corresponding key terms. Please take a note. Section. These are the key terms for complex repair. Concepts are same, but by using of these key terms, you can simply identify the type of repair. Then, so guys, the repair codes are applicable for sutures as well as staples. For staples, if provider use staples to close a wound, means we can able to apply the code for repair. Okay, for simple for staples, usually it comes under the simple repair. So for sutures, material and staples, we can apply the code for repair. But for steri strips means you should not apply the repair code. That means this. You should not apply simple, intermediate, complex repair for steri strips. Take note, should not apply repair codes for steri strips. Very, very, very important one. For adhesive strips, we can use sutures. We can use a repair code. Adhesive strip, ADHESIVE. Adhesive strips, we can able to use a repair code. But for sterile strips, we should not apply the code for repair. Very, very important. Please take a look.
Ma'am, what is the other strips you just mentioned now?
Adhesives. 1 minute, I text you. Adhesive. Okay. For adhesive strips, should not apply the code for repairs.
Ma'am, for adhesive strips, we can apply the codes from repair, ma'am. And we
Yes,
not apply
yes, we
for
can apply the
sterile
code.
strips. Yeah.
For sterile strips, should not apply the code for repair. Shall we move to the next?
Yes, ma'am. Yes, ma'am.
weekend, that means usually the repairs or measured in centimeter. Same group we can add, different group should not add. So that things are documented here. Then the last point is same like that. Debris is also considered as a separate procedure. So we should report the code separately for debris. So what is the concept? What is the line? What is the meaning for this line means? Now, when you are reporting the code for complex is the highest intensive procedure, am I right? Then intermediate, then the least is simple. Complex is the highest intensive procedure, then the least is intermediate, then the next one is intermediate, least is simple. If you are going to report the code for simple, if you are going to report the code for highest intensive procedure and the lowest intensive means should append modifier 59. For example, now try this. If you are going to report complex and simple means, how can we report? Complex and simple repair. Complex is our primary. Secondary should be
Simple.
Simple with the Okay. Suppose intermediate and simple means how can we report? Intermediate and simple repair.
Primary,
intermediate,
primary, secondary, both is modified with 59 modifier.
So guys, 59 always report with the second CPT only. It's not applicable with the primary CPT. So 59 modifiers always report with the secondary CPT only. For example, intermediate and simple means should apply the modifier 59 with the second simple one. Clear? Is there any doubt? Any doubt in this in this concept of repair? Because this is a very, very important one. Please ask. Is there any doubt? Please say yes or no, guys.
Yes, ma'am, understood.
Okay. So please take a key point. Tissue transfer. Adjacent tissue transfer means ATT. Take the abbreviation of adjacent tissue transfer, ATT. ATT means adjacent tissue transfer. So in that, the primary defected area is the affected site. Secondary defected area is the harvested site. Primary defected area is the affected, injured site. Okay. Primary defected area is the injured site. Secondary defected area is the harvested site. So the tissues has been harvested from the upper back and placed on the arm. So here, what is the guidelines means? We have to add the value primary defected area and secondary defected area and get the code for the total score. Total square centimeter. You have to add the value of primary defected area and secondary defected area. Actually, so here in this measurement is given in a length and breadth. So if length and breadth is given means you must multiply the value. So in your not only for this adjacent tissue transfer, for excision also. For excision also, if measurement is given in a length and breadth. Length and breadth means you have to multiply the value. Here, primary defected area, length 1.0, breadth is also 1.0. So you have to multiply the value. 1 into 1.0 into 1.0. What is the value? 1 into 1?
1.
1. So the primary defected area value is 1. Then the secondary defected area length is 2.0, breadth is same 1.0. What is the value of 1.0 into 2.0? 2. So primary defected area value is 1. Secondary defected area is 2. So 1 plus 2, 3.
3.
So you have to get the code for 3 square centimeter. I have to get the code for 3 square centimeter. Then the very most important thing is with the ATT, excision is inclusive. In the same anatomical site, suppose if a provider perform excision and ATT means code only for ATT. In the same anatomy, please take a note. In the same anatomical site, if physician perform both excision and ATT means code only for ATT. Code only for ATT. In the same anatomical site, if surgeon perform both excision and ATT means code only for ATT. Did you understand? Please take this.
Yes, ma'am.
Okay, please take this formula also. This is the formula of ATT.
Noted, ma'am.
Oh. Okay. Next. Now, here also we have a classification for anatomical location, guys. For adjacent tissue transfer for trunk 10 square centimeter or less, go for 14000. From 10.1 to 30.0, go for 14001. So 14000 for adjacent tissue transfer. The location is trunk. If a measurement is less than 10 square centimeter or less, and from 10.1 to 30.0 means 14001. Same like that. Under the code description, we have some classification for the different anatomical trunk, leg, face, eyelid, like that. So under the go and check with our book. Under the code description, we have some code section for another anatomical site also. In that, at last, 14301, 14302. So any anatomical area, if the measurement is up to 30.0, we have to select the specific code. From 30, any anatomical area, if the measurement is from 30.1 to 60.0, go for 14301. Beyond 60, for each additional 30, part thereof, go for 14302. For any anatomical area, 30.1 to 60.0, go for 14301. Beyond 60, for each additional 30 or part thereof, go for 14302. Now, how can we report the code for 31 square centimeter? Sorry, 61.
14301 and 14302.
Correct. 14301, 60. Then the remaining 1% also we can up the code of 14302 because of part thereof. Suppose if the term part thereof is not present, means for every 30 only we can apply the add-on code. Suppose if the term part thereof is not present, means we can apply this add-on code for every 30 square centimeter only. So for 61 square centimeter, for first 60 square centimeter 14301, then the remaining 1 square centimeter also go for 14302. Clear? Is there any doubt?
No, ma'am.
Okay. Then take the key point. for adjacent tissue transfer? Patient. That means donor and the recipient are same. Harvest from our one location and place on the another location. Homograft or allograft means harvest from one patient to place on the another patient. That is allograft. Harvest from one patient and place on the another patient. Xeno or heterograft means from another species for another example like a pig, goat, like that. So from another species or a man-made or synthetic are considered as xenograft or heterograft. Please take a note. The definitions are important. Not only for this chapter, for the entire chapter, the meanings are same. Doctor make the place as a suitable for graft. Doctor prepare that location for suitable for the graft. So doctor clean the wound and make some surgical preparation for graft, before graft. So surgical preparation, when a doctor perform both surgical preparation and a graft means we have to report both of the code. We have to report both of the code. Now, these are the code section for surgical preparation. Here also of 15004. So there are 3%. For 1%, 15004. Then the remaining 2%, 15005 into 2. There are 3%, guys. For 1%, 15004. Then the remaining 2%, 15005 into 2. Then same like that. Then another example for trunk. Trunk, that 350 square centimeter. For trunk means you go for 15002. How can we split the value for 350? How can we split the value?
100 plus 100 plus 100 plus 50.
50. 100 plus 100 plus 100 plus 50. For first 100, 15002. 100 plus 100 plus 100 plus 50. For first 100, 15002. Sorry, what is it? Okay. For first 100, 15002. Then remaining how many units? 1, 2, 3. You should not add the values again. You just count the unit 1, 2 and 3. So 15003 into 3. Did you understand?
Yes, ma'am.
So take these two examples, guys. I think everybody know that skin substitute graft, substitution of another species. Skin substitute graft. So porcine graft, pinch graft. Okay, you are see pinch graft means pig graft. That means doctor harvest the skin from pig and place for human. Doctor harvest the skin from pig and place for human. That is called as porcine graft or pinch graft. Okay, now these are the substituted. Sorry, this is not a skin substitute. This is a code for skin substitution graft. Then these code section for autograft. In autograft, split thickness graft, same like the trunk, arm, leg, same group we can add the value. Different group we should not add the value. So for a split thickness graft, trunk, arm, leg, first square centimeter, 100 square centimeter are 1%, 1,500. Each additional 100 are 1%, 1,5101. These two code section for split thickness graft. And for epidermal autograft, 15110 and 15111. And for dermal autograft, 130. Please wait. Hey, Kirti. Give a definition for a full thickness graft and a split thickness. Please take the definition. A split thickness autograft means, that is the definition. Suppose if the name of the graft not documented by the provider means, by using of this description, you can easily identify the graft. So for full split thickness autograft, that involve epidermis, portion of dermis. That involves epidermis and portion of dermis. That involves epidermis and portion of dermis. A full thickness autograft means that involves epidermis, entire thickness of dermis. So epidermis, portion of dermis means that is split thickness. Full thickness means epidermis, entire thickness of dermis. Epidermis, entire thickness of dermis. Entire thickness of dermis. Now, this is a code section for skin substitute graft. Skin substitution graft. Substitution means substitution of another species or man-made or synthetic. So here same like that, same group we can add the value, different group we should not add the value, same thing. But application of skin substitution graft, if the total measurement is less than 100 means go for 75 and 76. If the total graft measurement is less than 100 square centimeter means go for 15275 and 15276. More than 100 means go for 76 and 77. See that. Up to 100, that means up to 99 square centimeter. Up to 99 square centimeter, go for 75 and 76. Here anatomical guys, face, scalp, eyelid, mouth. Here also face, scalp, eyelid, neck, mouth. Locations are same. According to the total measurement, the codes are classified here. So from, see that here, greater than or equal to 100. Greater than or equal to 100 means you go for 77 and 78. In that first example, 95 square centimeter. Is this less than 100 or greater than 100?
Less
Less than 100. Less than 100. Here, how do you split the code? Check that. How do we want to split the code? Guys. First 25, each additional 25. Okay, you have to split the code as 25. So how many 25 that are present in 95? How can we split? 25, 25,
420.
and 20. Am I right? 50, 75, 80, 90, 95. Yeah. So 25, 25, 25 plus 20. For first 20, for first
15275.
6, then the remaining how many unit?
3.
3. Am I right?
152.
Then, oh, sorry, 75. Oh, 75.
76.
75 and 76. Okay. So for first 25, 15275, then the remaining 3 units, 1, 2, and 3, 15276 into 3. Okay. Then in that second example, for right hand 125 greater than 100. Am I right? For greater than 100. Now check that. How do we split the code for 75 and 77? 77 and 8. How do we split?
100.
100 plus 25.
100 for 2. 100 plus 25.
No. 100. So add and primary code is also for 100. Add and code is also for 100. But in this, primary code is 25. Add and code is 25. That's why here we are split the code as 25, 25. But check the values. Primary code is also for 100. Add and code is also for each 100. So that's why 100 plus 25. For first 100, 15277. Then the remaining 25, 15278. Then 250 to 250. How can we split?
100 plus 100 plus 100. 100 plus 100 plus
50. 100 plus 50. For first 100, 15277. Then the remaining 100 and 150, 15278 into 2. Guys, did you understand how do we split the code? Did you understand?
Yes.
Okay, take the example. Take these 3 examples, guys, with the heading. See that flap means supplying of own blood supply through the pedicel-like structure. See that. This is a pedicel-like structure. Own blood supply through pedicel-like structure. Okay. Now, you just check that there is no guidance here. This is direct coding. So, according to the procedure is flap. It's also called as tubbed pedicel. So, for trunk 15570. For arm, scalp, arm, legs go for 15572. For forehead, cheek, chin, mouth, neck, axilla, genital, hands and feet go for 74. Eyelid, nose, ear, lips, intraoral 76. So according to the anatomical location, here we have to select the group. That's it. According to the anatomical location, here you just want to select the group. And the fat grafting. So for autologous is nothing but autograft. Autologous is nothing but autograft. For autologous soft tissue graft, 15769. For autologous soft tissue graft, 15769. 71, 72, 73, 74 for fat graft. Fat graft by liposuction technique. Liposuction. Suction means, doctor suck the fat for the site of trunk, breast, scalp, arm, and leg. 50 cc or less, 71. Each additional 50 go for 72. So 71 and 72 for the anatomical location of trunk, breast, scalp, arm and leg. Then 73 for face, eyelid, mouth, neck, ears. How? What is the measurement of 75 and 73 and 74? How do we split?
25 cc or less.
25, 25.
And each additional 25.
25 and each additional 25. I have to split the measurement as 25, 25 like that. So this is a fat graphic. Next, pressure ulcer. It's also called as decubitus ulcer. So I think everybody know that pressure ulcer is nothing but bed sore. Pressure ulcer is nothing but bed sore. So for excision means removal of coaxial pressure ulcer. The anatomical location is coaxial. Procedure is excision. Anatomical location is coaxial. So for primary suture 920, flap closure 22. Primary suture means doctor just make a suture to close the wound. That's it. Doctor just make a suture, stitching. Doctor says just to make a suture to close the wound, go for 920. So flap means doctor harvests the tissues from one location and place on the defected area. So for flap closure 22. 31 for sacral pressure ulcer. The above two code for procedure is excision. You have to check the procedure first. Next you have to check the anatomical side. So the procedure is excision. Anatomical location is the excision of pressure ulcer. Anatomical location is sacrum. Same like that. Primary suture 31 with the ostectomy. Suppose if doctors also remove the bone. Remove the bone also means go for 33. Primary suture with the ostectomy go for 33. Skin flap closure alone 34. For sacral pressure ulcer, skin flap closure alone 34 with ostectomy 35. 36 and 37 for 36 and 37 for muscle or myocutaneous flap. Location is same. Sacrum. Location is same, guys. Sacrum. But for muscle or myocutaneous flap, go for 36 with the ostectomy 37. Here you just want to check the procedure and the variation, anatomical side also. Any doubt? Any doubt in this question? Sorry, in this section? Any doubt? Guys, am I audible?
Yes,
Yes, ma'am. Some burn, first degree, second degree, third degree. First degree burn that affect the epidermis only. Second degree, it will affect epidermis and dermis. Third degree, it will affect subcutaneous beyond the subcutaneous and beyond the subcutaneous. That means it affects also muscle and bone. So 16004 first degree of burn, 16004 first degree of burn, 1620 to 30 for second degree, 160,202, 16030 for second degree burn. In that, for small, less than 5% of total body surface 20. So whole face, whole extremity. What is the meaning of extremity? What is the meaning of extremity?
hands and legs.
Hands and legs. Super. So either right or left leg, any one. Right or left leg or right or left arm. Any one. There are 4 extremities we have. There are 4 extremities we have. In that 4, any one extremity that fully burned means that will lead us to the medium. Or if the total body surface that lies between 5% to 10% means go for 16025. Then 16030 for large, more than one extremity, or greater than 10% means go for 16030. So these three code sections for second degree bone, and 16035 to 36 for third degree bone according to the incision, number of incision. 16035 and 36 for escharotomy, for initial incision 35, for each additional incision 36.
Ma'am, in second degree burn, in medium, whole extremity implies just one extremity or more than one
fully
extremity?
burned.
Only one extremity.
Extremity fully burned. That is full extremity. More than one extremity means it automatically leads us to the large.
Okay, large. Okay.
Large. Okay. Then, guys, please take your CPT book and go and check with the code description. Here you have one table, burn estimation. That is also called as rule of 9. That is also called as rule of 9. So everybody, I don't have a, 1 minute, I check that. I think I don't have a CPT book now in my laptop. See, yeah. No, this is update. CPT 2020. See this guys. This is a rule of 9. This is an estimation of rule of 9. Burn estimation, rule of 9. By using of this table, you can able to get the total body surface area. This one. You can get the total body surface, 5% to 10, less than 5, total body surface area. So more than 10% means you should consider it as large. So by using of this table, you can easily fetch out the burn percentage, total body surface area. Here, the particular anatomical sites are given in our left side of our table. In the top of our table, the corresponding ages are present. For example, patient ages 65-year-old. So patient comes under which category? Adult. So what is the code for neck adult? What is the percentage?
2%.
Neck 2. Head
7%.
So the total body surface area is 7 plus 2, 9%. Okay. So suppose in your document, they did not mention the total body surface, but the name of the anatomical locations are given. Name of the anatomical locations are given. So head 7, neck 2. So you have to add 7 plus 2, 9. Now check that L means left lower arm, right lower arm. LU arm na, that means left upper arm, right upper arm. Check that what are the total percentage for right upper arm, left upper arm, right lower arm and left lower arm. What is the total percentage? Left upper, left lower.
8 plus 6.
8 plus 6, how much?
14.
14. Okay. So left upper arm, right upper arm, left upper arm, right lower arm, left lower arm. So 4 plus 4, 8. 8 plus 3, 8 plus 3, 11. 11 plus 3, 14. So the total body surface area is 14. 14%. If it is 14% means it will comes at under which section? Which section, guys?
Second degree one.
Second degree. Then what is the code?
Medium. 160.
No.
No, sorry. More than 20.
16030. More than, that means greater than 10. So here the total body surface area is 14%. 14 means it will lead us to 16030. Okay. Usually for third degree burn, they are giving the incision only. They did not give the percentage. They do not give the percentage. So he just give the incision, number of incision only. So for 3 incision, how can we report? 3 incision.
16035 and the 16036
into 2. 16035. 16036 into 2. That's it. Okay. Did you understand the concept of burn? Is there any doubt? Then one more important thing. Guys, if you have any 1 or 2 chapters pending for you guys, any 1 chapter, 2 chapter pending. Guys, if you only 1 chapter pending, only 2 or 3 chapters pending, do you have any pending chapters? No. So, okay. So this is your first, actually, we are starting the session from the beginning for all of you. Am I right? We are starting the session from the beginning, from EN. Am I right?
Yes, ma'am.
Okay, thank you. Destruction also, we have to report each lesion separately. Am I right? So now we are going to discuss about the concept of destruction. In that destruction, codes are classified as pre-malignant. Guys, the meeting will going to end less than 1 minute. So please rejoin again. I have a meeting at 5 o'clock. So please rejoin soon. Okay. I will start the session within 2 minutes because I have a team meeting at 5 o'clock. So please join everyone within 2 minutes. I will start the session soon. So pre-malignant lesion. So here destructions are classified as a pre-malignant, benign and malignant, like excision. Here also we have to fetch the code based on the characteristics of neoplasm. Here also we have to fetch the code based on the characteristics of neoplasm. Benign, malignant. Lesion 17000, second through 14 lesion each. The term each is present, so that's why we have to apply the code from second through 40th lesion each. For example, see that pre-malignant 12 lesion. Pre-malignant 12 lesion. So for first lesion 17000. Then the remaining 11 lesion 17003 into 11. Because of for each lesion we have to apply the code into 11. So if the lesion is 15 or more means we just apply the code only 1 time because the term each is not present in this code description. Each is not present in this code description. So that's why you just apply the code only 1 time. So for 22 lesion, go for 17004. We just apply the code only 1 time. How can we report the code for 14 lesion? Try this 14 lesion. How can we report the code for 14 lesion, guys?
1700 plus 1700.
003 into 13. Into 13, because we have to report the code for each, from the second through 40th lesion. For each lesion, we should report the code. So 17000, then 17003 into 13 for 14 lesion. For 15 means, how can we report?
1700
1700412. Okay, 1700412. You will just apply the code only one time. Did you understand the concept of pre-malignant lesion? Take these two examples, please. Quick now. Please take these two examples. Here we want to apply the code only one time or each lesion. For 17110 want to report the code only one time or for each lesion? Only one time, because the term each is not present, but here the term each is present. So that's why here we are reporting the code for every lesion. But in this code description, the term each is not present. In this code description, the term each is not present. So that's why we just apply the code only one time. So up to 14 lesion, 17010, 15 or more lesion, 17000. So we just apply the code only one time. We just apply the code only one time. And for malignant lesion, we already discussed in our excision also. So for the concept of excision, shaving, dissection, we should report the code for each lesion. Here also we have to apply the same concept. So trunk 2 centimeter, leg 2 centimeter. For trunk 2 centimeter, 17262. And leg 1 centimeter, 17261. 17261. See, 2 minutes at the class. So 17261.
Your voice is breaking. Your voice is breaking.
Okay. Is it okay? Did you understand the concept? Like excision, here also we have to apply the code for every lesion. Clear? Clear now?
Okay, ma'am.
Okay. Okay, guys. Take a key point. Take a key point. Please quick. Please take a key point.